Hi everyone, welcome to Fast Intelligent Care. I'm Chanelle, and in today's episode we have our guest Belinda Dwyer. She is an OT lecturer at Flinders University, and we've worked together a little bit in terms of having some workshops or training days for students. So I thought it would be good to have her for our 4-part series to talk about student experiences, pressure care education, looking at some challenges and wins in terms of placement, and also looking at what the experience is with early career clinicians or new grads, and we'll get going. So we'll start with our part 1, which is looking at current challenges and wins within pressure care education. But firstly, Belinda, I want to say thank you for being here today.
Thank you for having me.
It's a pleasure. And I'd love to hear a little bit about how you got into OT, your previous experiences, and your current role.
How I got into OT, I actually wanted to be a paediatric OT until my final placement, and then I was involved in adult rehab and felt that was actually more my passion rather than paediatrics. So, but then, I suppose my career's developed from working in acute settings, so we're handling and rehabilitating acutely ill people. And then I moved into private practice. So a lot of my private practice work has been in manual task training for people in acute settings, vulnerable people, people in, who have mobility challenges in community settings, and aged care. So I suppose that's where my passion for pressure injury management from that context really arose. And then, I also undertake care and needs assessments and ergonomic assessments sort of in workplaces. So really, I suppose, focusing on both the carer's comfort as well as the client safety, dignity and comfort and injury prevention.
That's actually a really good wide variety of perspectives that you can bring to pressure care education. Yeah. Something that I do want to ask is what you find is potentially challenges currently in pressure care education?
From a undergrad or from a student perspective? I suppose it is more, while we can give the students theoretical knowledge, so we introduce them to the tools, pressure care staging, the foundational concepts of envelopment, repositioning, etc. Until they actually get out onto placement and see real people, they really don't solidify their knowledge. So I suppose it's that transition between fully as a student to then placement practitioner to then early practitioner, I suppose is a challenge, and that's where we see the growth.
And is there any preparation within pressure care education in terms of preparing them for navigating different funding bodies like NDIS, things like that? How to go about that? Yes,
a bit challenging when the funding bodies change, particularly sort of the aged care changes that occurred back in November and the NDIS changes. So certainly, that underpins the training that we provide them, or the education that we provide them, in terms of really when we're looking at teasing out the clinical reasoning and getting them to think about the clinical reasoning behind their decisions for interventions, and not just sort of support surfaces, but other repositioning recommendations. Look at it from a number of different funding perspectives. Obviously, if they're working in the acute setting, from a hospital perspective, in terms of those resources, as well as out in the community setting. So we then sort of introduce them to the aged care funding, as well as NDIS funding.
Yeah, that's great. And is there any specific wins you feel like we have currently within pressure care education, things that you really feel like we're doing really well?
I think that the opportunities for the students to actually experience, particularly the support surfaces, so that they can actually, when we're talking about the concept of offloading heels, that they can be lying in a bed or in a recliner or a comfort chair and getting the feel of where the pressure is on their bodies, on their ischial tuberosities if they're sitting, what's happening to their bodies if they're sort of lying in supine, side lying, and the different products, I think is really, really important so that they get that understanding rather than, again, as I said, a theoretical concept.
Yes. Is there any parts of pressure education that you think we can improve on?
I think it's really difficult. I suppose some of the feedback that we get from students is, until they've actually seen a pressure area, rather than, I won't say pretty pictures because they're not, but diagrams, sort of the different stages, until they actually get that real life experience, it's very difficult for them to conceptualise. And also the feedback some students give is it's uncomfortable because you're actually looking at people's skin, and particularly sort of around the sacrum, sacral areas, or sort of around the genital areas. It can be quite confronting for them. So, but I'm not sure how we overcome that because we need to think about dignity of clients, etc. So there's no way that we'd be able to use bodies or even simulations of those. I don't think at this stage.
So how does it currently work with placements? Is that where they do start seeing, with the placements, they do start seeing their own clients?
Yes.
Yeah.
So at Flinders, they have an observational placement, which is really tagging along with a therapist. But then our students at the moment have started their first of their two 8-week placements. So clear supervision model where their autonomy grows as they progress through.
And with your background in manual task training, how does that help in terms of pressure education, making it more than just about support surfaces?
So my background, I am very much about moving a person comfortably and really considering all of the factors in terms of repositioning. So with manual task training, it is about enabling that client to do as much as they can rather than the carer doing things that the client can do. But also I was thinking about all those contextual factors, so really thinking about sort of the framework. I tend to work to the PEO, so thinking about those person factors when you're actually moving them. Body habitus, larger sized bodies obviously have their own challenges, so we sort of incorporate some of that, as well as just the handling methods. So in terms of looking at a slide sheet, while a slide sheet is a friction reducing device, it can also cause a lot of shear if it's been inappropriately positioned in. So a lot of my training tends to focus around how we will actually apply a slide sheet or a hoist to minimise damage to generally fairly vulnerable skin. The reason we're using these devices, primarily if we're looking in the bed situation, is because of immobility and the inability of that person to be able to move themselves.
And do you feel like students know how to advocate for pressure care? Or do you think that's something that comes with confidence once they actually...
Talking to my new grads or grads that have been out a couple of years, they basically said that their confidence grows with their experience. So coming out of university, they may feel partially confident, just depending on the nature of their placement. However, they feel that once they grasp the concepts, they've got the experience, they're more comfortable talking as part of that multidisciplinary team, that their confidence for that grows.
Okay, that's great. And something that I wanted to ask as well is if you've probably come across some OTs that have come from overseas. Have they had any different experiences in terms of perspectives with OT, perspectives on pressure care, maybe things that they've done differently to how we do things in Australia? Maybe lower resource contexts or stuff like that?
Probably in our course we don't get to explore that in a great deal of detail. We offer a master's course, which means that we do have most, if not all, of our international students are actually direct entry, so they've had a degree before them. So some, have come from nursing backgrounds, some might have come from OT backgrounds, and I think it varies from country to country from the feedback that I've been given, but probably can't answer that in too much more detail. Sorry.
No, that's okay. Yeah, because I know with South Africa, like, in terms of support services that are available, it's definitely not as high tech as what we get here in Australia, and probably a lot of the understanding about the importance of pressure care is not necessarily there. Being understaffed most of the time, but I was wondering if that was something that you might have come across as well. But it's
not in specific, I suppose, for pressure care. No.
Okay. Do you feel like students are engaging differently with pressure care than they did years ago? There's been a huge change over the years in how we've approached it.
Yeah. I think the fact that we've got more pressure equipment, which the feedback also can be from them, is quite overwhelming and too much. But I think, we've got more pressure equipment. So obviously with additional research in terms of pressure mapping, changes in structures of foams and air, reactive and active surfaces, I think that is a bonus. I also think the fact that we have now a lot more access to podcasts, short webinars, rather than, and we can probably thank COVID for that, I'm not sure, more social media, just even in terms of those short TikTok, which they engage with quite well, rather than,
go read
I've got to attend this PD session, and I feel like I'm the new graduate with all of these very experienced OTs. I think sometimes that would be a barrier in terms of attendance, whereas if they've got short, sharp, something that they can be listening while they're running, while they're driving, it all helps with that. So I think, from that resource point of view, it's way better than it was back in my day.
Yeah, because you can learn it in a way that works for you as well. And actually, it made me think of something. If there's anything that you think has particularly worked well for students, that we could do better in terms of product suppliers or wholesalers that you think could be incorporated to assist students? Because I know we've done a bit of workshops where we've done, we've covered a little bit of the theory, but like you said, that's covered quite well within the university. But something that, if we're looking at maybe doing more seating, or not just looking at pressure care with mattresses, whether there should be a different perspective, what we could do as clinical educators.
I mean, obviously seating and support surfaces from a supply point of view is your bread and butter, isn't it? So I think the fact that your willingness to, for you, come down, travel from interstate, to provide education, to give the students that experience of feeling the different support surfaces, the equipment, etc., without doing a hard sell. And the fact that, I know from our workshops you stand up there and say, well, I am from Enable, but, and I'm going to be showing you our products and equipment, but also acknowledging that there is a whole range, outside of what you're offering, that they can also consider, I think is a really, really important message to be getting across to them.
Yeah, and like you said, it can be quite overwhelming for them as well. So is there something that you would advise students who do say it's overwhelming, all these products that are out there, that something that they have to focus on to maybe help kind of cut through all the noise?
So what I say for students is, don't focus on the product. Focus on what you're wanting to achieve in pressure injury care. So, and then work with your supplier. So it's more of a partnership to say, well, okay, I need this, 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 and this. What have you got? And really form that partnership. So they fully understand, or should fully understand, the client's needs.
Yeah.
They've been out to the home or into the environment that they're operating in. So they're thinking about all of those environmental contexts. They're thinking about the person context, but they're also thinking about how that person then operates within that to then form a clinical decision. But they don't necessarily need to know all the ins and outs and the specifics of all the different equipment. That's where the suppliers come into the fore.
Yeah.
So working in a partnership to then go to the supplier and say, well, these are my needs, what have you got that can support that? And really from that perspective then it will help them with their clinical justification, depending on which funding body they are asking.
Great advice.
For.
Thank you, Belinda, for your time.
Thank you, Chanelle.
In our part 2, we'll talk a little bit more about student placement and feedback from students during that placement time. And we'll see you guys next Tuesday.